Light and cells actually is a good combo. Light in different frequencies can really help target different tissues. So when we are giving people stem cell infusion, not only we actually put the cells under light for a couple minutes to activate them. Not only that, if we shine the light on particular organs, that activates certain adhesion molecules. So there's more interaction, more ability for that organ to trap the cells.
Because I'm sure it's not just doctors who are kind of in a bubble about stem cells. I'm sure most people hear stem cells and kind of think sci-fi. Because, well, that's where we're at with the general population, is because all of the stuff from medicine just filters down into the general population. So it seems like something, if you talk about stem cells, it seems like something a little bit scary, maybe. It seems like something that only elite people can do. It seems like something a bit futuristic. Maybe you can just kind of update us on where stem cell therapy actually is, rather than, perception.
Yeah. So people did not have the concept of stem cells. So we're just human bodies, I guess, just living on, and we didn't know how it kept going, right? So in late 50s, early 60s, when they started doing bone marrow transplant, they just thought if we transplant bone marrow from one person to another, it seems to help different conditions. So if the blood is bad, then if we just put the bone marrow from one person to another, then we can help this new person recover. And they didn't know that there were stem cells in the bone marrow. So they didn't, so that came about later. And then we realized, so there were these specialized cells that are very primitive, that they have different potentials. So themselves really don't have a lot of functions because they're not a working cell, but they have the ability to start dividing and produce offsprings that are working cells. And then they make another copy of themselves to preserve its own population. So these cells can replenish their own supply. And at the same time, they give you replenishment, so you can regenerate your tissue or whatever organ or blood. And they thought we only had stem cells in the bone marrow. So this is how it all started. It was like, okay, so those cells are in the bone marrow. That's where they are. And then they realized, I guess stem cells are everywhere. Every organ has organ-specific stem cells. That's how your organs can continue. Liver has liver stem cells, heart muscles are heart muscle stem cells, cartilage have cartilage stem cells. So they all have this, and every organ has this end stage stem cell, which itself still doesn't do work, but it has the ability to replenish. However, ever since you were a fertilized egg, right, you were once a single cell. Just think of the miracle, that now we're talking. So from that single cell, it can start dividing and migrating and make these interesting structures and eventually form organs. And everywhere along the way, just think before it forms the end organ, all those variations of cells are stem cells until it reaches a working cell status. And that's how we can have all these organs and walking around and functional. So right now, not only in each organ we have these stem cells, but we have something a little bit more general. They're like generalist stem cells, which are these mesenchymal stem cells. So everywhere in your body, along your blood vessels, anywhere you have blood vessels, you will have these mesenchymal stem cells. So they perform a very specific function. They huddle around blood vessels, and they have the ability to sense what goes through the blood. And they also sense what's going on in the neighborhood. So they're like the conductor of the symphony of regeneration for your body. So if they sense something that's passing through in your blood, that's really a rescue signal, something that's going on in a particular area that's in trouble. Like let's say you cut yourself. So then they can squeeze themselves into the blood vessels and swim to find the signal. I always think of a salmon, swimming upstream to find where they need to be. And then once they get there, they squeeze themselves out of the blood vessel. And now they start working. Now they can send signals into the blood to bring the immune system over. Now they can give signals to local stem cells and make them start to regenerate. They can recruit and send signals to all the immune cells so they can break down scar tissue. They can remove dead cells and unnecessary components that's in that neighborhood. And now that area is cleaned up and ready for new tissue to form. So they really are a crucial step for regeneration. So now we have all these stem cells. So it has become very famous because it's very easy to grow. So you can multiply them in an incubator and then you can give it to people, and they are immune privileged, which means if I put the cells into, let's say, into Johnny from Jenny, and so Jenny's genetic material is not going to manifest in these cells. So the mesenchymal stem cells, MSCs for short, that goes into Johnny is not going to trigger an immune response. Not only it doesn't trigger, it calms the immune system. So much so that you can use these mesenchymal stem cells to give to people who are getting organ transplants. That actually reduces their chance of rejection. So it has a calming effect. So these cells, there are a lot of functions of these cells. This is one reason they're so popular, because they're so easy to use and they don't cause problems during transplantation, especially if the cells are younger. So the older the cells are, the harder it is, because when the cells are older, there's less immune modulating properties. They also are less adaptable to the new body. They also have less ability to recognize cancer cells, because these cells actually have anti-cancer properties. They can detect cancer and fight them off and kill them off. But the older the cells are, research have shown that with direct comparison, side-by-side comparison of fat-derived stem cells, which are MSCs, these MSCs versus umbilical cord derived MSCs. The fat derived MSCs, which is from adult person, will make the cancer grow. And the umbilical cord derived MSCs will make the cancer shrink and go away. So they're very different. So just because we're talking about, these are mesenchymal stem cells, doesn't mean that you can use them universally from anybody, anywhere, and they all perform the same way. No, there's a lot of nuances.
That it would be interesting to hear a bit more about that, if you can share also about the way in which it needs to be, like you could take it in, whether it's like for injection, or I know you have cream, but like also you're talking about umbilical stem cells. What is the ideal environment for somebody, or does it depend on what you're dealing with and how they would obviously receive the stem cells?
Yeah, it's very much going to depend on what we're trying to deal with. But the cells, the beautiful thing about these cells is that they are really smart. Sometimes all I have to do is just put in the body somewhere, and then they will go to work. And that's what it's so safe, right? It's very challenging to really find bad things about getting these stem cell treatment, especially if you don't practice unsafe medicine, right? For example, a Florida clinic got shut down because they blinded 3 people and they were injecting cells into the eyeballs. There are certain things that you don't do that if you're not understanding how these cells are functioning, what they can do. So you're taking very highly invasive, high risk procedures, and then yes, there's a problem. But for simple IV treatment or simple joint injections, I'd be really hard pressed to see really bad things, especially if you use cells that are very safe, which means stem cells that doesn't have the potential to cause tumor, right? If you use embryonic stem cells, which are cells that's obtained day 5 to 7 after fertilization. So those cells, those early, in the ball of, that early embryo, within that early embryo, you can, that's very early, right? You can get some cells from the center of this ball, and those can become any tissue of any organ. So they're very powerful, but so powerful that they can also go haywire and start to make uncontrollable tissues and different types of tissues, causing teratoma. So that's one thing that people have heard of, that someone got embryonic stem cell treatment and maybe got injected somewhere, and then they get a tumor in the back. So that's been pretty common, but not for umbilical cord derived stem cells. So there are nuances. What kind of cells are you using? And how are you putting in the body? So all those are important. So the safety of the cells you're choosing and the safety of your protocol. And that's what I'm trying to teach doctors, I founded an academy, American Academy of Integrative Cell Therapy, where we talk about all these different cell sources, how you decide what to do, what to use, and then exactly where are you going to put it, depending on what we're trying to help. So the body has either some kind of systemic condition or has a local issue, right? So autoimmune conditions is very systemic, and local. The most typical is osteoarthritis in joints, muscle tendon tear, or brain conditions, different organ issues. So you approach them differently for more systemic issues and even for local problems. An IV treatment is very, very powerful. I mean, this is not just me saying it. It's because it's proven by a lot of research. So not only when you put the cells in the vein, it gets flown back into your heart, and that gets pumped everywhere into your entire body. And the cells can find their way to where the injury and inflammation is, and then can, get there and do the work. But also they talk with your immune system. So it's not just about traveling to a place. It's also about bring your own repair system on board, right? Like, the photobiomodulation, like how do you elevate your body's ability? So this is about, this is why it's regenerative. This is smart medicine. It's waking up your own body. So if you put the cells into
brain barrier join, does it cross the blood-brain?
Depending on what kind of cells, there's still the cells are fairly large. The blood-brain barrier, most of the cells cannot cross, but mesenchymal stem cells have been found to cross to a smaller extent. But we do something in the clinic to open up the blood-brain barrier. So we actually give mannitol pre-infusion if a person wants to target the brain. There's either brain condition or even neuropathy. We often are using mannitol infusion. So when you give mannitol, it actually shrinks the gap junction. It shrink the cells lining the gap junction. So it opens up the gap. Now the cells can pass through. And that's about 40 minutes after you provide mannitol. So we use that window to get more cells into the brain. We can do joint injections, right? We can inject locally because the joint space in the joint, especially larger joints like the knees, shoulders, and hips, there's not very much exchange between the fluid within the joint capsule. So it's good to inject right into the capsule so that cells can start working. Otherwise, you're waiting for the signal to come through, and it's going to be a very slow process. It takes about a couple of months to equilibrate between what you put in the blood and what's in the joint capsule. So you want to attack from both angles. But also for larger joints, the outer 1/3 of the cartilage is nourished by the blood supply, and the inner 2/3 is nourished by the synovial fluid in the joint space. So, if you want to target the full thickness of cartilage to trigger their growth, then you want to put cells in the IV and put cells in the joint.
You did mention then a bit about embryonic and umbilical stem cells. I think probably one of the reasons why a lot of people are a bit wary of stem cell therapy is there like an ethical issue around that? I know Chantel and I have been to a lot of longevity events, and sometimes this comes up at the events. There's sometimes,
oh really? Even in that crowd, you think this crowd is more educated? But okay, let's put this to rest. The cells that have been used in the U.S., I don't know if you're talking about ethical concerns. That means where the cells came from, right? Mm-hmm. So yes. In the U.S., you cannot treat a person using embryonic stem cells. So that's not legal. Also, you cannot treat the person using fetal cells, which means the fetus that have not been born, right? This is not the most famous place that does that is Ukraine. I don't know where's that now, but that's their claim to fame, that they collect these fetuses. Oftentimes it's aborted fetuses, from what I hear from scientists who have visited their facility. These are from, a lot of Russian women who abort their pregnancy. And then some of them purposely do that because they get compensated. So they would sell, basically the fetal tissue, the fetus. And then that's, taken apart and, blended. And that's what I hear. And then given to people. So that is not allowed in this country. And what we use is umbilical, besides using your own, right? We can always get from your own bone marrow, your own fat, and or even menstrual blood, and there are different places you can get stem cells. But the most common will be from the fat, bone marrow, or umbilical cord. So I don't think people have any ethical objection to using our own. The only ethical objection is umbilical cord. I think people confuse umbilical cord with embryonic stem cells. So maybe they sound a little similar, but umbilical cord is attached to a live baby. So we only obtain these donations when the baby is born and they're alive and healthy and the mother is smooth, everybody's well, there's no emergency involved. And actually this is all through planned C-section, because the lab I work with would not want to jeopardize the quality of the cord, mostly from the contamination standpoint, because the vaginal canal harbors a lot of bacteria and all kinds of there are all kinds of things in there. So to avoid contamination, then cesarean section is the preferred method. So the mother is all ready to go. This is all planned. Okay, anesthesia. You can open me up, right? And then you take the baby out. The baby's happy. You clamp the cord and you cut the cord off. The baby is completely fine with the mother, and the cord and the placenta is put in a normal saline bag and sent overnight, shipped to a lab most of the time. So that's where the cord comes from. Before we knew about the stem cells that these tissues very rich of, we were throwing them away, routinely, right? And it's the biological wastebasket. So that's where it comes from. And the mothers go through very rigorous testing as far as their own past history, not just their health history, but their travel history, employment history, sexual history. So family history, of course. So everything that's related that can be affecting the quality of this cord. They're donating. This is a pure donation, because the sale of human tissue is prohibited in this country. So you can't be compensated in any way. So there's no incentive for people to lie just so that their tissue can be accepted. So that's kind of the framework of how the tissues are obtained.
And the way in which the umbilical cord or like the placenta is preserved, like you said, I'd be curious to know, because you hear a lot about what I've read with people that have heard that they like eat the placenta or things like that for the nutrient, but like in terms of preserving the stem cells and having them, is that super important by the point in which it's injected? Like any other?
Yeah. So you need to preserve. So that's the trick. How do you? Of course, you can always use it fresh. So I know there are a few clinics that does it fresh. So you get the cord tissue, you separate it out, and you don't freeze them, and you give it to people. But there's severe limitation, right? So how you have to use it within a day, right? Maybe 2 the most. I mean, you have to really use it right away. Otherwise, the cells will die. So how do you preserve that? Yeah. You can use the cryopreservation method, which is an art of itself. So you can freeze something, but doesn't mean when you unfreeze it that they're still going to be alive. So that's the art. So they use cryopreservative to help prevent crystal formation in the freezing process. And that's by not only putting a substance in there to prevent the crystal formation, but also by lowering the temperature very, very gradually by 1 degree per minute. So if you drastically freeze somebody, that's it. That's it says hot. But if you really, really slowly, imperceptibly almost to the living cell, then they kind of just gradually slowed down their metabolism to the point where, you think about the cells oscillating, all the organelles, and then they just get, slow to the point where it's still. So you're putting them in a freezing position, state by really stopping all the biological activities. And then by the time when you need to use them, if you can do rapid thawing, then it's better for the cells. Then quickly everything's back to normal temperature, and then they can be alive again. If you do it too slowly, at a particular temperature, crystals can form, so they can still puncture the cell wall. So that's why I don't advise people to warm cells with their hand. It's better to do it in water water bath. The conduction is much faster. And then the temperature is actually a little higher than your temperature the temperature on your hand. So that's how they keep the cells alive.
And what do you see? Because now you've been doing this for a while. I mean, you're an expert in this field. So what do you see that's kind of the most astonishing for you? Or have you got some case studies that you're most particularly proud of using this method?
Yeah, there's so many. One of my earliest, of course, I'll tell you my first case, how I got hooked. It was somebody in the holistic health space that's in the probiotics business, who's traveling all over and go to all the trade shows and a lot of walking involved. He was 69 years old, but he had a lot of knee pain, osteoarthritis. So he said he saw 2 orthopedic surgeons who told him, absolutely, you need bilateral knee replacement. No question, is bone on bone. So just don't even bother. So he came to me, said, I really don't want to do the surgery. There's always risk and there's long recovery time. So I don't want to, right, put artificial, things in my body yet. So let's try stem cells because you do stem cells. Like, great, let's do it. So again, my approach is to attack from both angles. So I give him an IV infusion of stem cells and I give him joint injection, 1 cc into each knee. And what's interesting was the next day, he said, I said, how are you feeling? He said, yeah, I feel fine. And what's interesting is that I slept through the night, and I have not slept through the night for the last 4 decades, because when his car rolled over, when he was a teenager, being in an accident, it tore his rotator cuff and it never fully healed. So every time when he shifted in his bed in the middle of sleep, it would wake him up from the sharp pain. And then that night he slept through, and then he kept sleeping through. And the shoulder was pretty much, that was fixed, right? It never bothered him again. And then his knees gradually got better and better to the point, I think within a month or 2, he was walking a lot. And till this day, he's walking 4 miles almost every day. And he said, I barely feel I have knees. I don't think about it. The only time he noticed there's something is that he said when he goes downhill, there's a little bit twinge. I had only given him 2 treatments, I think spaced about a year apart. So the first one he did great, and the second one he said, let's top it off. Let's do a maintenance thing, and that was it. So this is 8 years later, right? This man never needed a knee replacement. So that was what's interesting about the shoulder, is that I didn't know anything about his rotator cuff injury. So he didn't tell me. I wasn't thinking about healing that part. That's why I'm saying about the intelligence of the cells. I can put the cells in the body. The cells just know where to go because your body will tell the cells. So that was my first case. And not too long after, there was a patient that had liver cirrhosis. And basically, the death is very close. He's in hospice care. We didn't know how long he had to, if you're in a hospice care, usually a month or 2, something like that, weeks to months of life. His brother wanted to save him as a last ditch effort. So we did stem cells. And I didn't even give him a high dose because at the time, my protocol is a low dose in the beginning and then a higher dose 2 weeks later. So I only gave him a very low dose. So I was waiting for him to come back and he didn't. And I didn't know what happened. I tried to call and didn't get an answer. And then a couple months after that, I was on a radio show. And the person that introduced me to this brother actually brought the brother on to that radio show that I didn't know. It was a surprise. He said, oh, so-and-so is on the line and you treated his brother. I said, okay, amazing. How's your brother? Because I haven't been able to reach the brother. He said he's doing amazing because on his way back to Sacramento after stem cell treatment, because he had ascites, a big swelling, right? A lot of fluid collection in the abdomen. He's just the 5 hours of drive, the swelling was halfway down. So a huge reduction in the swelling. And then within weeks, he was walking around in the yard, talking on the phone like he's a normal person. When he came to see me, I could barely hear him. He was so emaciated and so weak that it's hard to hear what he was saying. So, and then within a couple months, within a couple months, he went to his doctor. Of course, he checks the liver function regularly, and it was normal. So there's a reversal of his liver disease. And to me, it was just so shocking. So he got liver cirrhosis from Hep C, from intravenous drug use. So that was shocking because I did not anticipate. I thought, okay, it's going to help a little bit, and then we're going to keep repairing. So just to see how drastic the results can be, and that really gives me hope. And I started revising my protocol, thinking that maybe I can give people less, so they will spend less money. Right? It would be better. So why do I want to give them more and they pay more? So I did go in the other direction a little bit too much, because I think maybe I ended up giving people the wrong impression that with one treatment, if it didn't work, that means stem cells didn't work. And then I realized, because I've had cases where at the first treatment, the person didn't notice anything. But after the second, there was drastic response. And the third, even more dramatic. And that's when I realized I may have, shortchanged my patients by not, advising them that sometimes it takes multiple sessions, that healing takes time, but everybody have different timelines. So you don't want to give people this false impression that one treatment would just solve all the problems. We're not performing miracles here. Although that liver case to me was like a miracle.
Yeah.
That is shocking. But it happened. And so how do you, right? He was written off. Modern medicine had nothing to offer him. So there's no other way to explain. The swelling going down within hours of the treatment. And I've helped people with all kinds of, the COPD is another one that I love treating, lung conditions. Again, modern medicine has almost nothing to offer. Steroid, just oxygen. So I've gotten people off oxygen tanks and off almost all medications. So there's really nothing in modern medicine that helps break down scar tissue. Maybe they can use some kind of mechanical method, maybe shockwave and etc. But drugs, no. But stem cells can. So mesenchymal stem cells, one of the properties is antifibrotic property. So they can break down scar tissue. So for liver cirrhosis, for COPD, or for other kinds of fibrotic conditions. So they all have, these fibrosis and sclerosing of the different organs, right? The liver, it can happen in the heart, so it can break down scar tissue as a result of heart attack. It can break down scar tissue in testes. It can break down, scar tissue, of course, musculoskeletal. So it's pretty cool to know that the cells can do that. Yeah, we treat a lot of autism kids, and we're getting really good results. So we have a very special protocol, but that's another area that's very, very difficult. I know it very well because I've worked with so many as a psychiatrist, and it was very unpleasant. To me, it was a very unpleasant experience because I didn't feel I truly helped. So if you're a doctor, you're there to help and you see suffering, and then whatever you did didn't really do that much. It's a very, very, very discouraging experience. Like I didn't feel good. I was like, why am I doing this? I still can't communicate with the kid. The kid is, I'm sedating the child. I'm not making the child more functional. The child is not gaining ability to communicate or to relate, right? Emotional connection with people. And, or as far as, incontinence and some of the behavioral therapies maybe help a little bit, but it's very limited, very arduous, long process. But stem cells, I have seen people improve rapidly, sometimes even, the same day. There's almost like the brain was inflamed, and when you calm the inflammation, all of a sudden, a lot of the ability and the function or the communication pathways are opened up, and they can have quick changes. Oftentimes it takes longer time, but still that's a very fast track of progress. Yeah.
Yeah, that it was interesting when you're talking, because obviously red light therapy is also doing that, like reducing that inflammation, which is, I think, one of the reasons for things like autism. But it's a good, I was thinking it's just such a good combo, because presumably, you know, the stem cells are going where they're needed, and things like autism, there is a strong gut component there. I'm sure, you know, you probably know. Yeah, if you heal the gut, stop inflammation because you're stopping all the
Right. Yeah.
or metabolites. So I wonder.
Yeah. Light cells actually is a good combo. Actually, did a lecture on this. Light in different frequencies, different wavelengths, can really help target different tissues. So when we are giving people stem cell infusion, not only we actually put the cells under light, different colors. So we have this cool machine that has light well. So we put the cells bathed in light for a couple minutes to activate them. And then we put an IV back and give it to people or inject into different tissues. So we activate them with light already. And then while we're giving people stem cells, we have the light going, focusing on different organs. Because what happens is that not only the light can make the cells more mobile and more proliferative, so they're actually gaining more potential to make offsprings, but they're metabolically more active, so more viable, so they have healthier existence. And not only that, if we shine the light on particular organs, that activates certain adhesion molecules. So there's more interaction, more ability for that organ to trap the cells. So all of a sudden, he's like, oh, you're stuck here, stay here and work in this organ. And that's really what we want, right? We want the cells to be an organ that we want the cells to repair. But I don't like the invasive methods when you have to inject into an organ. That could be, there's problems with it, but you can with skilled hands, you can put the cells right there. But I'm, not going to inject somebody's kidneys or someone's bladder. I don't, there's still a risk to it, but I can do it very elegantly by focusing the light on particular organs. Yeah.
Well, Joy, could you give us an example? I know you say it's case by case, it's different, but just an example of a protocol. If someone came into the clinic and how, depending on what they're dealing with, obviously if it's super refined, what you kind of couple with the stem cells.
Yeah. Right. First of all, thorough evaluation is really important, right? We understand what the person's constitution. The only people really I see people getting side effects are people who have hypersensitivity, like histamine type of reactions. So they are the people that may break out with a rash. They just have hypersensitivity to a lot of things, chemicals, food, medications. So we're careful with them. But when they come in, usually we can run labs, get a baseline lab, and we give them a whole set of supplements that increase their blood flow, increase their building blocks, the availability of building blocks, which are amino acids to build more structures and protein to repair. We give them fulvic acid, which really contains a lot of trace minerals, so we can replenish the body of all these essential minerals that perform all kinds of biological functions. So we want to address all that. We want to prime the soil, right? Give them everything that's needed. We also give them something called stem regen that will release more cells from their bone marrow, because what I give the patients, a lot of them will end up in the bone marrow. So I want the cells to get out of the bone marrow and circulate and work. So we give them a set of supplements, and then we also use peptides with our treatments. So if we're targeting immune system, we have peptides to enhance immune health. If we're targeting the brain, then we have brain peptides. If we're targeting metabolism, sugar metabolism, etc., we have those peptides. So it really depends on what each person needs. Then we tailor make and we target the organs more specifically. And then we use light, right, to focus more on that organ. So the light we can actually program to different frequencies. So wavelength is set. There's red, green, and violet colors, but then we can program different frequencies, and those frequencies will talk with different type of cells in the body, depending on what organs you're trying to talk to. So it's really fascinating. And then we also give them a different thing. We have a light bed. So light is an important component. We actually have people go into this light bed that has not only light frequencies, but also quantum frequencies to help with the healing of the body. So we want to help them detox, help them elevate the rejuvenation capabilities, right? Activate the mitochondria. And then, so that's pretty much the protocol that we're putting everything together to prime the soil, and then of course depending on what the person needs. If they want hair restoration, right, we can do a hair procedure. If they want facial rejuvenation, we can do the face, or sexual rejuvenation. We can inject things into the vagina and penis. We can put the cells in different places.
Yeah, that's amazing. I mean, it is frontier medicine. It does feel like it's still frontier medicine, and there's so few experts in the field, but it is so gratifying to hear about doing things in a more holistic way, and trying to move away from the drug model. I'm not that. Yeah, it's needed in some cases, but the problems that we're dealing with in our modern society aren't really those cases. Acute cases, potentially, we do need to have the drugs, but most of the time we need to find different solutions, especially in this kind of field we're in, which is longevity. You need to have something that's going to increase your longevity in your health span. Otherwise, you're kind of, if you're treating with drugs, you're kind of limiting the amount of years you have healthily, because there's always a price, right? Your liver's got to detox it. There's always a price to be paid for the drug.
I know. Yeah. When you tinker with nature, just be aware of the consequences. Yeah. So I just, and I think, to me, the reason I've incorporated so many things into our protocol is, I think when something touches my brain, it's like, once the knowledge is inside of me, I would like, just on a conscience level, like my own conscience will not allow me not to utilize it, not to give it to patients. It was like, okay, now I know I can't unknow this, and I know how powerful and how important it is. And if I don't give it to patients, then I'm not doing justice, for their health. So that's why I just keep adding on these different modalities.
And I think it's also rare to have, like Sarah said, amongst all this oils, people are focusing on one area, one specialty. So it makes one hesitant to know how you would couple them. Because there's a lot of experimenting or a lot of research. So it's amazing that you take each case by case and you have all these things kind of incorporated. You've actually answered most of my fire round questions by just everything you're saying.
I was thinking, yeah. Well, maybe I'll tell you another fun case. But there are quite a few. There's another one. I was talking about breaking down scar tissue in testicles. So I had a patient, because we have all kinds of people who are desperate for solutions, and they find their way to us because stem cells are their last resort. They tried everything with their doctor, right? They trust their doctor. They did everything, and they took all the drugs. And even this guy who came to me had one of his testicles cut off because he was getting swelling and inflammation, and then infection. So he was in some, right? The testicle got huge and was infected and pain. So his urologist said, "Well, let's forget it. We've tried everything. Let's cut that off." So he lost one testicle, and then within a couple years, the other testicle is doing the same thing. So now he's facing the possibility of losing that one as well. So then he contacted us and said, "Dr. Kong, can this help me? My testicles have been swelling, has been infected. Can this help?" So I looked through literature. And there's no report on this particular case. So a lot of times people come to me with more obscure cases. So it's not the most common. So then no one is spending the money and energy to study it, right? If it's not as common. So then now you rely your knowledge as a doctor, your understanding of the pathophysiology of why this happened. But a lot of times we don't even know how it happened. However, a lot of times we do know that there's inflammation involved and there's a lack of immune support. So the immune system is not able to fight it off. The inflammation is not fought off. The infection is not fought off. What's going on? So there's inflammation, immune dysregulation, or immune lacking involved. And then there's tissue damage involved. There's fibrosis, and there's maybe issue with blood flow. So any of these factors, the stem cells, the reason mesenchymal stem cells are so powerful is one, it's incredibly anti-inflammatory. You can calm your inflammation, so your system can shift from this inflamed state to the state of repair. So it reduces inflammation, so your body can shift into repair gear. And also modulate your immune system. So your immune system shifts from a more inflammatory state to more anti-inflammatory state. This is one reason for autoimmune diseases is so powerful. And then it breaks down scar tissue, we talked about. It promotes vascular formation. So it generates more blood vessels, delivering more blood flow, and so more oxygen and more nutrients, and remove toxic waste. And then it's directly antimicrobial. It actually can secrete antimicrobial peptides to fight off microbes for you. Wow. It's anti-cancer, so it can detect cancer and can send this ligand called to a trail ligand directly tell the cells to pop off, basically kill yourself. And so that's a powerful ligand. That's how it can kill cancer. And then it can also protect cells. So when the cells sometimes don't have to die, like in stroke, circumstance or crush injury, the area that got cut off of blood supply, they die. But the neighboring cells don't have to die. But just the way nature is set up, that when there's a blood supply cut off, when the cells start to die, then they send out all these chemical signals, and it triggers this calcium cascade, eventually leading to cell death to all the neighboring cells. So now you've got a big, like the brain infarct size compared to where the blood supply was cut off. So, but stem cells can come in and salvage it. They can actually prevent that process, from happening. So stopping it midstream. So there are all these properties of the cells. So that's why when I talked with this patient with a testicular swelling and infection, okay, we know infection is going on. There's inflammation. There's some the lacking in immune support. And there's a fibrosis because he had nodules, testicular nodules going on, fibrosis going on. So let's do IV stem cells. I'm not touching your testicles, I like to do IV, and I think it can help because cells will go where it needs to go.
Yeah.
Lo and behold, within 2 months, all the nodules went away. The testicles went back to its normal size. He was ecstatic. His testicle was saved. So that was a very interesting story in every way.
That's a great story. Yeah, it's amazing. I don't think I was aware quite exactly how it worked. The inflammatory piece was maybe a new thing.